Hi everyone. Today we're going to talk about something I love to do, and that's the benefits of regular health screenings and checkups. So what is this really? Well, your checkup, as we call it, is basically your yearly exam, and the whole point of you doing this is to make sure that we're checking to make sure your health status is normal or up to date, and we're screening for certain conditions. So what's the benefit of this? Well, the benefit is one, you know where you stand as far as your health goes. Every year you come and get a checkup. It's a comprehensive check from head to toe. The doctor examines you, labs are done, and then this is the opportunity to get vaccines, up to date on certain screening tests, and to make sure that you are up to par when it comes to your health. Another added benefit is this is the opportunity for you to come and ask questions of your doctor. What should I be getting done? Establishing a relationship with your doctor. You'd be surprised at the things that I can pick up on my patients when I've seen them regularly. I know if your countenance and your mood is different. I can tell if your walk is different. There's a lot of things that I can pick up because I know you. And that's why it's so important to have a personal relationship with your primary care doctor, because believe it or not, we watch those little things. And that's why I'm comfortable enough to bring up, you don't seem yourself today. Or I noticed that you're walking a little bit different. Tell me what's going on. The small details I can pick up because I know you. But if you don't have a regular physician, a primary care doctor, you're constantly seeing somebody new, and they're not going to pick up on those small details. So what happens when you come in for your routine physical or checkup, as we call it? Well, first, you're going to be met by the office staff. They're going to check you in, verify your insurance, and get you ready to come to the vet. Next, they're going to do what we call vital signs. So we check your blood pressure, your weight, your temperature, watch how you're breathing, which is your respiratory rate. Look at how much oxygen you're getting with an oxygen saturation that goes on your fingers. So that gives me a picture of your overall status even before I walk through the door. And then when I come in, we're going to go through your history. Are there any updates? Did you have a new surgery? Has anything changed in your family history where you found out that someone close to you may have been diagnosed with cancer? After we go through your history, we start with your exam. So the doctor is going to evaluate you and examine you. We're going to examine your eyes, your ears, your nose, your heart, your lungs, your abdomen. We're going to check you basically from head to toe. And then after that, we'll give you recommendations on screenings that you meet criteria for. So maybe your blood pressure was a little bit elevated. What else do we need to do? Or maybe you gained some weight. How can we help you to decrease that weight and be at a more healthy weight so that that prevents other complications? Or maybe it's time for your cancer screening. So when we start cancer screening, we'll talk to you about what age we start certain things at. Your pap smears and when they start, your colonoscopy and when that starts. Do you need a CT of your lungs because you used to be a smoker to screen for lung cancer? So we'll go through those things and give you recommendations. Afterwards, with my office, you'll also have a follow-up so we can discuss all those results. Because you don't want to get these things done and say, well, the doctor never called me, so I guess everything's okay. You and I will have the opportunity to sit down and talk about every single test that we did, so you know your overall health status. And then I'll give you recommendations as to how frequently you and I need to see each other. Is it just once a year because you're good, you're healthy, your cholesterol is good, there's no signs of diabetes? Or maybe I now need to see you a little bit more because your blood pressure was elevated, or because you have a new diagnosis of diabetes, or because there was a condition or something wrong with your thyroid. So always make sure that you schedule these once a year. If you never see a doctor again, once a year you should be seeing us. And then if there are health concerns, we'll talk to you about what else that you need. So now you know why you should get this checkup, and now you know that there are multiple doctors that are available as your primary care doctors to take care of these healthcare needs. So if you have not scheduled your annual checkup, you make sure that you call your primary care doctor, and if you don't have one, give us a call. 832-619-1669. We'll be happy to schedule you for that annual checkup.